Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, urgent care, and today I'm also affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is very interesting: the role of testosterone in men's health. Joining us today as our guest speaker is Mr. Jeff Selick, and he's going to talk to us about what are the role of the testosterone, and also he's going to touch the very important topic, Gameday men's health, and how it helps men with a low, how it helps men's health. So good morning, Jeff, and welcome to my health talk.
Thank you, Dr. Prasad, for having me.
And I'm so happy to have you today. So first of all, would you please give your introduction to our viewers?
Thank you. Again, I'm Jeff Selick, franchise administrator with Gameday Men's Health. My wife, who is our medical provider, and I are very proud to be opening up this business in Bloomfield Township. We have 4 wonderful children. Our oldest is 18, is a senior at Bloomfield Hills High School.
Okay.
And we are just very proud to be providing the men of Bloomfield Township in the Birmingham area with the wonderful opportunity to be their very best.
So that's great. Yeah, we are very happy to have you on board here. Yeah. So the first question, let us talk about testosterone and what is the importance.
So testosterone is a sex hormone that plays a very important role within the body. First, it regulates the sex drive, the libido.
Right.
Second, it helps with bone mass, fat distribution, muscle mass, as well as strength.
Right. Yeah.
It increases production of red blood cells. It also supports mood, enhances energy as well as motivation, and it can also help with erectile function.
Right, yeah, because I have read a lot about the testosterone, written a couple of articles about men's health, what helps this group with having a normal lifestyle. But coming from you, it makes a big sense right now. So what are some of the common symptoms when the testosterone gets low?
So this is probably the most important thing to identify, and unfortunately a lot of men don't realize that there are symptoms and signs to low testosterone. They just associate it with getting older and think that it's normal.
That is true, yeah.
But a lot of the common symptoms and things to look for, problems sleeping, like insomnia, brain fog, low energy, fatigue, loss of muscle mass or strength. A lot of men might have a very rigorous exercise regimen, but no matter how much work they put in, they are still losing muscle mass or even putting on weight.
That is true, yes.
Depression, loss in sexual appetite, or even difficulty getting or maintaining an erection.
Yeah, so there are a lot of side effects for the low testosterone. Just like in the women, it is estrogen deficiency,
yes,
leading to all those issues. So what are the causes and prevalence of it? What are the causes?
So sometimes it can be just as simple as older age, but there are other causes like obesity, type 2 diabetes, obstructive sleep apnea. Sometimes it's chronic medical conditions.
Hypertension.
Yes.
Thyroid.
Kidney disease.
Thyroid?
Yes. Cirrhosis of the liver. It could be medications such as beta blockers, opioids, antihistamines, antidepressants, or even anti-anxiety medications that could cause a lowering of testosterone.
Yeah, you mentioned about beta blockers, which Makes sense because I have so many patients come to the emergency room, urgent care, with mental depression and all that. And that was linked to the beta blockers. When you
Yes.
stop the beta blockers, replace with another medication, they were kind of getting better.
Yes, and something that I think is very important is education in this area, even when it comes to physicians. A lot of men will go to their primary care physicians and complain of these symptoms, doctor, I have low energy or I'm depressed. And rather than their doctors telling them to get a testosterone test, they want to put them on antidepressants.
I know.
And, this is what I'm passionate about is to get awareness to tell men, when they go get their blood panels, they don't normally test for testosterone.
Right.
We want to get men off of antidepressants and we want to get their testosterone tested because that really could be an opportunity to put them on natural bioidentical testosterone cypionate and get them off of antidepressants.
Right. And it makes sense though, antidepressant, to some extent that it has. But overall, if somebody has been replaced with others, this will always help. So another one thing that, I attracted my attention is the Gameday Men's Health. So
Yes.
tell us about that.
Yes.
Very exciting to
Yes,
know.
thank you. So it's probably no surprise to you, Dr. Prasad, that men typically don't like to go to the doctor.
Right.
So we've found this amazing model that was created out west in California by a brilliant doctor named Evan Miller that introduced this model, and this is a franchise that we purchased, and we are bringing the first one to Metro Detroit. So my wife and I are opening up this model at Square Lake and Woodward to introduce this concept to the Bloomfield Hills, Bloomfield Township and Birmingham area.
Right.
And the concept is to set our practice in a Detroit sports-themed man cave environment.
Oh, okay.
When you set a doctor's office in this type of environment that doesn't look like a white, sterile environment, but it looks like a sports man cave environment, it's going to set the man at ease.
Like a sports medicine.
Correct.
Clinic.
When he
right.
comes in, all of our exam rooms are themed after the sports venues that closed in Michigan and Detroit. So exam room 1 is the Pontiac Silverdome. Number 2 is Palace of Auburn Hills. Yes, number 3 is Joe Louis Arena. Number 4 is Olympia Stadium.
Yes,
so
yes.
it just puts the man at ease where it's not so scary like exam room 3. It's something a little bit more relaxing. So we have 4 core treatments that we do, and that's it. Number 1 is testosterone replacement therapy.
Right.
Number 2 is treating erectile dysfunction and performance enhancement. Number 3 is weight loss with semaglutides and tirzepatide. And number 4 is vitamins, supplements, and peptides.
I was going to ask you because that's so important,
Yes.
isn't it?
And we stay in our lane. That's the 4 core treatments that we do, and that is it.
So when somebody walks into your place,
Yes.
first of all, there will be a questionnaires and all that. Of course, you will find out what their back history and all that and what they would like, right?
So one of the differences with Gameday as well is we do everything digitally before they even come into the office. As a man, I don't like when I walk into a doctor's office and they hand me that clipboard and I have to answer a bunch of questions like 8 times on 3 different forms.
Yeah.
We send that all out before the man comes in. He can do it digitally on his phone, and then when he walks into the office, we whisk him right in. So everything is done before the man even comes in, and then it gives my wife, the clinician, an opportunity to review his medical history before he even comes into the office.
Okay, and your wife is a family practice.
Yes.
So she knows exactly how to
Correct.
do those things, right?
Yes.
Okay, so that's good, and that's the way you go. Now, let's just start with the testosterone.
Yes.
So you check in the urine, how do you?
It's actually done, and that's a great question. So we have a lab right in our office.
Okay.
And, men are all about speed and efficiency. They don't want to go to a separate appointment to a lab and then have to come back. So any man that comes into our office that's experiencing symptoms of low testosterone, we're going to give a free blood test
Okay.
for the testosterone and a PSA test.
Yeah,
because
right. So I was going to ask you.
Yes.
So important for
we feel
men,
that
PSA.
yes, we feel that every man deserves to know his numbers for free, to know his PSA numbers and his testosterone numbers. So when they come in, we're going to give him a free blood test to know his PSA and his testosterone, and within 15 minutes, we'll have his testosterone numbers, give him a free consultation, and if they are suffering from symptoms of low testosterone, we can start them on testosterone replacement therapy that very same day.
Okay. Now, when we are talking about the replacement therapy,
Yes.
what do you
Yes.
give them? What do you give them?
Great question. So,
it's not the real hormone, right?
So yes, it actually
You
is.
do the
We do
substitute?
testosterone cypionate, which is a bioidentical testosterone.
Okay, so supplemental.
Yes, and we do two
supplement.
treatments. One is injectable. That we would put, intramuscular, whether it's in the thigh or whether it's in the arm, gluteal area. Men can either come into our office and we'll do it for them once a week, or we can do mail away. There's no difference, whichever they prefer. Or we do the pellet injection, which is a slow release over the course of 3 to 5 months for people that travel or just don't want to do
Right.
injections
You put a pellet
in the gluteal region.
Oh, in the gluteal area.
Yes,
Oh, okay.
and some men opt for that as well if they just, like I said, travel or they just don't want to deal with injections weekly.
That helps,
But we
right?
find that it's much more effective than topicals, much more effective than pills to do that bioidentical testosterone. And then we find that, men start to feel the best that they felt in years. Those symptoms go
Right.
away, and they feel like they did in their younger years.
Now, what age group, Jeff? What are the age group you are treating?
Yeah, so men that typically, as they get to the age of 30, start to lose
Is that so? Only
1%
30?
or more of their testosterone per year. Now, that's
Okay.
not to say that men in their 20s can't start to lose their testosterone. I have
Sure.
talked to men in their 20s.
Really?
But we usually find that men over 30 start to feel the effects of losing testosterone.
Oh, okay.
And then all the way up in age as well. It just really depends on, every man is a little bit different.
Right, every man is different. And then
Yes.
once they start on the treatment, you follow them
Yes.
up and see, what their diagnoses
Yes.
are and how.
But it's very interesting. The Endocrine Society thinks that it's normal for a man to have a range of anywhere between 300 and 1,000
Okay.
nanograms per deciliter, and that is quite a range.
Right, yeah.
So we're going to treat any man that is experiencing symptoms that's less than 600, because we feel if you're less than 600, it's common for you to be experiencing symptoms.
Right, yeah. So what are the type of partnership collaboration you are forming?
Yes. One of the things that I'm very proud of at Gameday is that we are not just going to stick a man with a needle of testosterone or semaglutide for weight loss.
Include other issues also.
And just send him on his way.
Right.
We want to have partnerships, which we have formed with nutrition consultants, with fitness centers, whether it is a personal trainer or a gym. We have worked very hard to develop these partnerships where when our clinician talks to the man, we want to make sure that he does have a fitness regimen in his life. If he does not, we want to talk about healthy lifestyles, go to our referral corner in our lobby, pull the business card of one of our fitness partners and say, we would like to refer you to this partner of ours to make sure that they are incorporating fitness and nutritional coaching in their lifestyle as well.
So that is very important.
Yes.
Fitness and the nutrition, they can.
And then in return, when somebody is going to one of our fitness partners,
They give you feedback?
well, not only that, but if they are exercising and, like we said, experiencing symptoms of low testosterone, working out, but not seeing gains, they can say, hey, go see our friends at Gameday Men's Health and get your free testosterone test.
Right,
So it's a two-way
So then it's a
relationship. Yes, it refers, both of us can refer each other, clients, and help each other along the way.
Right. And your place will be fixed, equipped with all the exercise machines and all the bikes.
So they do, and then they can refer us patients, and then we can refer them back for their opportunities for
And so far as
patients and clients.
nutrition is concerned, I'm sure you have good nutritionist also there.
Yes, so we're going to have nutrition consultants as well, and I've worked with chiropractors, I've worked with orthopedics, because again, once you earn, as you know, the trust of a patient, you're going to start to say, you know what, I have a problem with my shoulder, I have a problem with my back.
What
We're
am I
going to say, you know
going
what,
to
we don't deal with that, but let me take you to our referral corner and refer you to, Dr. Abrams in Bloomfield Hills, or let me refer you to orthopedic specialists of Oakland County. A referral partner of ours that we trust, and they can go to them as well, because I would rather give a personal referral than to say we just don't deal with that.
Oh, okay. So that's great. This is not just one thing, game day, it's including everything else.
Yes.
All together.
Yes.
Yeah. It's very good. I'm very impressed with this, with the whole thing.
Thank
so
you.
Where are you located, and how can people reach you?
Thank you. So we are located at the northwest corner of Square Lake and Woodward, in the 10 Medical Building. As we are right now at the beginning of April, the mobile gas station that most people know that's right in the corner that's being leveled and rebuilt, it's right next door to that in the 10 Medical Building. Our address is 10 West Square Lake Road, Suite 107. People can call us at 248-433-3900, or they can visit us online at GameDayMen'sHealth.com/Bloomfield Hills.
Okay, so it's very interesting.
We are
Gameday.com.
GameDayMen'sHealth.com. We are pre-booking appointments. We are opening on May 15th, but we've been very, very excited about all the excitement. We are pre-booking appointments right now with consultations on all 4 of our services, and we just really are excited to be able to help the men in the area to live the best life that they can.
That's very true. It's so interesting, just the topic of Men's Day Club.
Thank you.
Yeah, so that's very good. So anywhere the age range is like 30 above, and then
Yes.
there's always an exception.
Yes.
Like people with a history of chronic illnesses like diabetes, blood pressure, high blood pressure.
Yes.
There's everything that lingers down that reduces the testosterone, right?
Yes. There are certainly, certain people that we want to make sure that if there's any history of prostate cancer, we want to be very careful.
I was going to ask you about that.
There
people
is
with a history of prostate
people with a history of prostate cancer. We want to make sure that they receive clearance from their doctor. Anybody that is currently living with prostate cancer, we wouldn't want to treat. There have been several studies that show that testosterone replacement therapy will not cause prostate cancer, but we are aware that it can elevate the prostate level, and it can certainly thicken the blood. So we want to make sure that they do get clearance, and that's why we do regular labs, because we want to make sure that their H&H level, their hematocrit and their hemoglobin doesn't raise. And we want to make sure that their prostate level is in check. But it's very important that we check, and because Game Day Men's Health does check prostate levels, and there are going to be 800 Game Day Men's Healths around the country. We are going to be the largest screeners of prostate cancer around the country when all 800 are open.
That is so exciting to know.
And we're very proud of that.
Yes.
Very proud of that.
California. Started from California.
Yes, and we are the first ones in Metro Detroit.
In Michigan.
So I'm very, very
How
excited.
did you get it? How did you get the franchise?
I'm very,
Interesting
very proud
to know.
that I have a good friend that sells franchises, and after I was looking, like a lot of people after the pandemic, I was looking for something to sink my teeth into, a wonderful new opportunity.
Exactly,
and I wanted to join my wife in the medical field. And when she brought this franchise opportunity to me, I'm a big sports fan, and Detroit having such a great sports culture, and to be able to help men with this wonderful opportunity to make a difference. And, people ask me what I do for a living now, and I say I save marriages, with being able to help with, erectile dysfunction and testosterone.
Yes,
I really
yes.
do save marriages. So I just
Sure.
thought this was such a great opportunity to be
It
able
is-
to give
it
back
is-
and
it
help
is,
men
yeah.
and help marriages.
Yeah, because a lot of the time, men, they don't want to open up with somebody.
Right. And I take
Definitely
these phone
not.
calls, and what's really amazing, doctor, is, I'm the type of guy that answers phone calls 24 hours a day. After hours, the phone rings to my cell phone. Do you know how many men call at 2 o'clock in the morning?
Really?
And I answer that phone.
Is that so? Even at night?
This isn't telling people to call me necessarily all at 2 o'clock in the morning, but I get calls because that's when men are thinking about some of these troubles and problems that they have.
Sure, right.
And not to say that I won't pick up the phone, but if people are on the sofa and they're going on the internet, that's when a lot of men are facing these problems at 2 o'clock in the morning. So I've been amazed at how many calls come in at 2 o'clock in the
Really?
morning. Yes.
And you try to answer
And I
as
try
many
because
as you can.
want to be there for them when they're in their moment of trouble.
That
And it
is-
makes me feel good to be able to be there to talk to them when
Yeah.
you want someone to talk to.
And sometimes, even if you just talk to somebody, relieves anxiety. You don't have
Yes.
to be there in person.
Yes.
But you can still talk to somebody, who is lonely and
Yes.
give them advice, give them moral support. This is what a life is about, right?
And when you're the owner of the business, I think it gives peace of mind to them that I'm not just some person answering the phone. When I tell them my wife is the medical
Yeah.
provider, it really gives confidence to the person you're talking to.
Right, yeah. Yeah, that's very important because a lot of the time you call, about your own doctor, whoever, and you have to go through their answering service.
Yes.
Which is ridiculous, right?
And that's one of the big differences with Gameday Men's Health as a concierge medical service that, my wife comes from a family practice where it's about getting as many patients in and out as fast as you can.
Right. Yeah.
We're not about that. We're spending 45 minutes per
Yeah,
appointment here. This is about spending time with the patient, getting to know the patient, being there when they want to call and being able to
Right,
talk to them.
right.
So this is a very different approach.
Right, and with the support from your wife, I think this will do very well.
Thank you. We look forward to it.
Do you have anything else to add,
So again, we are looking forward to starting with these 4 core services. Who knows, down the road we might be adding services as
Right, yeah, as the
it comes
time-
along. Whether it's a hair replacement or
oh my God,
Botox.
That is
Who knows? We'll see.
Plastic surgery,
We're going to
right.
start with these 4 services, and we'll see how it goes from there. But again, opening May 15th.
But the Botox is
pre-booking-
mostly women, right?
Well, you would think, but there are men that certainly
that so?
do. That's why we call it Brotox. There are men that are interested in some of these services that aren't comfortable going to a med spa or going to a place that women go to. They want to
Right.
go to a place where they can feel a little bit more manly having these services done. And again, even when it comes to semaglutide services, they don't maybe want to go to a med spa where women go to. They're going to be more comfortable going to a place where men go to. So that's why we want to give them this comfort zone
Right.
of a man cave experience. So we know that the men are going to respond very well to Gameday.
Yeah. So that's good then. Last 1 minute keynote advice to everybody: stay healthy.
Yes, stay healthy, and it's time that men take care of themselves and give themselves some attention. For years, women have been doing hormone replacement therapy. It's
Right.
nothing to be embarrassed about. It's time that they embrace that this isn't normal to be living the way that they've been living. Do something about it. You only have one life, and take care of yourself. This is a chance to live the best years that you can, and we're here to be able to help them.
That is true. If we only have one life to live,
That's right. Live your best years.
Live the best. So thanks so much, Jeff, for coming to my show. I'd like to thank our viewers for watching me on this very interesting show, Role of Testosterone in Men's Health and the Gameday Men's Health with our guest speaker, Jeff Selick. And Until I see you again, have a safe and a wonderful spring and summer. Thank you again.